The NFL playoffs are better with FanDuel because right now new customers can bet $5 and get $200 in bonus bets, guaranteed. That's $200 in bonus bets, win or lose. FanDuel, an official sportsbook partner of the NFL. 21 plus and present in select states. First online real money wager only. $5 first deposit required. Bonus issued as non-withdrawable bonus bets which expire 7 days after receipt. Restrictions apply. See terms at sportsbook.fanduel.com. Gambling problem? Call 1-800-GAMBLER.
The following program does not offer personal medical advice. Please consult your doctor before using any treatment or product we cover. Welcome to Go to Health Media with your host, Jonathan Marks. We provide a welcoming environment where experts educate you on important health topics, answer your questions, and provide information from which you can benefit in consultation with your doctor. You can visit and subscribe to the show at gotohealthmedia.com. And now, here is Jonathan Marks.
Hey everyone, this is Jonathan Marks, and welcome back to another episode of Go to Health. Today we're talking about heart inflammation, and you'll find out on the show what that is. But heart inflammation can be deadly if it's left untreated. It's a condition that occurs when the body's immune system reacts to an infection or injury of the heart, causing pain and swelling in the heart muscle itself, the lining of the heart valves, or surrounding tissue. It can be unpredictable as some patients have severe symptoms and some almost none. Inflammation can also occur suddenly or progress slowly, but over time may lead to serious cardiac events like stroke or heart attack without intervention. Heart disease is the leading cause of death in the United States, and to treat cardiovascular disease effectively, cardiologists must aggressively reduce both inflammation and cholesterol in their patients. So our show today is called Doctors Learn New Ways to Prevent Heart Attacks. Find out how preventative measures and precise treatment of heart inflammation can lower your risk. Our guest today is Philip Nimoityn, MD. He's a clinical cardiologist at Cardiologists Consultants of Philadelphia at Thomas Jefferson University. He's a diplomat of the American Board of Internal Medicine and Subspecialty Board of Cardiovascular Disease, and he's a fellow of the American College of Cardiology. He's a clinical assistant professor of medicine at Sidney Kimmel Medical College at Thomas Jefferson University, and he's an attending physician at Thomas Jefferson University Hospital. He's also had many leadership positions over his years of service, and I present to you Dr. Philip Nimoityn. How are you, Doctor?
Good, Jonathan. Thanks for having me today.
Great. So tell me, what is heart inflammation? How does it occur? How does it develop?
Heart inflammation can involve either the heart muscle, which is called myocarditis. It can involve, as you indicated, the cardiac valves, or specifically what we're talking about today is vascular inflammation. And this is inflammation which affects the inner lining of arteries, supplying the heart muscle with blood or the brain with blood. And inflammation occurs when changes occur within the lining of the artery, where you get deposition of some lipid material. Inflammatory cells come into the area. They become embedded within the plaque that's developing in the artery wall. They produce inflammatory chemicals. And then at a certain point, they can cause the plaque to become unstable and to disrupt. And then the inflammatory chemicals get released into the blood within the artery, and that can stimulate clotting, which can then totally block off the blood flow to either the heart muscle or the brain, and then cause either a heart attack or a stroke.
That sounds pretty scary. What causes this inflammation? Do we know? I'm sure there are a number of causes, but can you give us a few examples?
So much of it is not known. There are a number of factors which have statistically been associated with an increased risk of coronary artery disease, family history, genetic, smoking, high blood pressure, high cholesterol, diabetes. But you can often have vascular inflammation without any of those factors, and you can have all those factors without it. So it's important to identify vascular inflammation, which can be actually measured with a blood test called high sensitivity C-reactive protein.
So is this blood test something that your general practitioner would do, or do you have to see a cardiologist for this?
Any physician can order the test. It's either called a high sensitivity C-reactive protein, or in some laboratories, a cardio C-reactive protein. That's a specifically different test than an older test that's just called plain, just C-reactive protein. And unfortunately, very often when people who are not used to ordering the test check it off on a lab slip, it gets checked off as the old type of C-reactive protein, which is just a non-specific marker for inflammation and ends up being the wrong test.
Does this affect people at any specific age? I'm sure as you get older, it's more likely, but does it also happen in young people as well?
It can be, but it's more common as you get older.
Got it. So if we don't have any symptoms, we're not seeing a cardiologist, should we start seeing or ask our doctor to start see a cardiologist when we reach a certain age so that we make sure that everything's okay?
That's a great question. When should you be evaluated? If you have a family history of cardiovascular disease, especially if it's at a young age, then you should be evaluated even as early as adolescence. But if you're a healthy person without any significant family history of cardiovascular disease, early adulthood would be a good time to get evaluated and have a lipid panel and have the high sensitivity C-reactive protein and a couple other blood tests done. There's another test that is very, very useful for predicting future risk called a calcium scoring test, which is a very limited CAT scan that takes only 10 or 15 minutes and has limited radiation exposure. However, that test is not generally done in individuals under age 30, because even if those people are developing any plaque in their arteries, it's unlikely that that plaque has developed the calcium that would be needed to be picked up by the test. So in a younger person, it would be a lipid panel and a couple other additional lipid tests. In an older person, you might add in the calcium scoring test as well.
So I'm getting the sense that even if you have no symptoms and you're not seeing a cardiologist, if you have a family history or you're getting to a certain age, let's say over 50, you should probably start seeing one just to get a baseline measurement of how things are going.
Well, I would agree with the first part. As far as age 50, I think if you don't have a family history, I think early adulthood would be a good time to do that. However, part of the evaluation can be problematic because in most situations, unless you're getting specialized testing, one of the factors that's used when people see their primary care physician is to do a risk score. And the risk score is a calculation that is done based on guidelines that come from the American College of Cardiology or American Heart Association. And those risk scores are looking at 10-year risk. And in a young person, you don't want to know 10-year risk, you want to know lifetime risk. And one of the biggest drivers of the risk calculation is age. So if you come in at a young age and you're looking at 10-year risk, somebody who might have a high lifetime risk could still be identified as having a low risk, and then that person could walk out and think they never again have to be screened. Each situation has to be individualized.
So what are some strategies and treatments to help treat heart inflammation, or is there a way to even prevent it? How do we minimize it, and how does it get treated once it's recognized?
The first thing is to do basic things to decrease risk of cardiovascular disease. That would include encouraging a heart-healthy lifestyle, which could include a regular exercise program if the individual's physician determined that it was safe for them to do so. The second would be a heart-healthy diet, which would be low in saturated fat and cholesterol, also limiting overall calories to try to avoid obesity, avoidance of smoking, and so forth. And then beyond that, based upon the laboratory studies and or including the calcium score, if that's appropriate at the person's age, looking at drug therapy to decrease any elevated lipid levels and also vascular inflammation.
What are some examples of the medications that would be recommended for lowering lipid?
Your time and expertise are valuable, making focus one of the most important resources to have at work. These days, professionals spend nearly half the work week on written communication, and it can be difficult to stay on task with all the emails and documents you have to get through. With Grammarly as your AI writing partner, you can stay focused and quickly get through your work with relevant real-time suggestions wherever you write. It works across 500,000 apps and websites, so it can help with everything, from brainstorming presentation ideas to sounding more confident and persuasive in emails and reports. For 15 years, Grammarly has offered best-in-class communication support and enterprise-grade security on a business model that doesn't sell your data. 93% of professionals report that Grammarly helps them get more work done. Download Grammarly for free at grammarly.com/podcast. That's GRAMMARLY.com/podcast.
Levels.
So for cholesterol, the cornerstone of treatment are the statins. Statins are drugs that have been around since the mid 1980s. They're very, very useful in lowering cholesterol. However, they have a reputation on the internet, and so many people are resistant to taking them, even though they're very, very useful and important drugs. There are a couple other oral drugs. There are a couple injectable drugs, and there's an infusion that can also be given intravenously for some patients. And then for the vascular inflammation, we had nothing up until 2023, last year, when the FDA approved the first drug for the treatment of vascular inflammation, and that drug is low-dose colchicine, which is marketed under the name of Lodoco. That's Lodoco. That has been shown to decrease people with either atherosclerotic cardiovascular disease or multiple risk factors for coronary artery disease. It can decrease heart attack, stroke, cardiovascular death, and need for coronary revascularization by 31%.
Now, you said we didn't have anything until 2023. Is this a new medicine or a new application of an old medicine?
Well, it's an old application of a new medicine, but at a different formulation and dosage level. Colchicine's actually been around for a couple of thousand years, but it's been used to treat other conditions such as gout and pericarditis. But at the doses it was used, it could cause side effects in a fair percentage of people. So this formulation is specifically designed and was approved at a lower dose. And this particular dose is very safe as long as the person doesn't have certain contraindications such as chronic liver disease, chronic kidney disease, certain hematologic problems. And there are some side effects, but less than with the older form of the drug.
And what are some of the side effects people may experience?
So about 10% of people that take the drug will experience either muscle aches or gastrointestinal complaints that may necessitate stopping the drug.
And where can we go to learn more?
You can go to the website, which is lodoco.com. That's LODOCO.com.
Got it. Lodoco.com. LODOCO.com. Great. And what else can you tell us about preventing heart disease? I know you mentioned exercise and a heart-healthy diet. Are there any other things that we should be thinking about as we think about keeping our hearts healthy?
I think checking the other testing, the lipid levels, the calcium scoring test, and being alert to any new symptoms that might not be responded to unless you're looking for them. So it would be any change in how you feel, including chest pain, shortness of breath, or dizziness with exertion, unexplained fatigue, and things like that. In women, the symptoms of atherosclerotic cardiovascular disease may not be as typical or as dramatic as in men. And therefore, you have to be a little bit more careful when women present with symptoms such as I've described, including in women unexplained fatigue. So there's been a concern that was raised years ago by the American Heart Association. Women's chest symptoms should not be written off as being non-cardiac unless they're evaluated first.
Got it. So that's an important distinction between men and women. Are there any differences in racial or ethnic makeup that we know of?
There is. Certain factors like hypertension, which is a big factor in the development of atherosclerotic cardiovascular disease, is higher in the African American population. And control of hypertension is very important. Less than 1/3 of people in the United States that have hypertension have it controlled. And in the African American population, the percentage that are controlled is even lower than the 30%.
Wow. Okay. So that really needs some attention. Great. So tell me the name of the drug again and the website where we should go to learn more.
It's Lodoco, Lodoco, like for low dose colchicine. It's Lodoco.com.
Lodoco.com. Great. So we've been talking with Dr. Philip Nimoityn, MD, FACC. He's a clinical cardiologist at Cardiology Consultants of Philadelphia at Jefferson University Hospital. Doctor, thanks so much for being with us today to tell us how to keep our hearts more safe and in good condition. Thanks for being with us.
Thanks for having me. Thanks, Jonathan.
Take care. We'll be back with another show very soon. This is Jonathan Marks with Go to Health. Bye-bye.
Thank you for tuning in this week to Go to Health Media. Be sure to join Jonathan Marks and another health expert next time. You can also catch the program on your favorite podcast platform. Until our next show, be sure to visit us on the web at gotohealthmedia.com and elevate your life.
Professionals spend nearly half the work week on written communication, so focus is important. With Grammarly as your AI writing partner, focus and quickly get through work with relevant real-time suggestions. And it works across 500,000 apps and websites, so you can sound more confident and persuasive wherever you write. 93% of professionals report that Grammarly helps them get more work done. Download Grammarly for free at grammarly.com/podcast. That's grammarly.com/podcast.
Americans love using their credit cards, the most secure and hassle-free way to pay. But D.C. politicians want to change that with the Durbin-Marshall credit card bill. This bill lets corporate megastores pick how your credit card is processed, allowing them to use untested payment networks that jeopardize your data security and rewards. Corporate megastores will make more money, and you pay the price. Tell Congress to guard your card, because Americans lose when politicians choose. Learn more at guardyourcard.com.